There is another emerging disease, especially in Kenya, and it was assumed that as you grow older, you will need to lose your teeth. That was the norm. There is this new trend of digging boreholes, especially in upmarket Nairobi. And this water coming from borehole has got a very high concentration of fluoride. We have caught up with the West as far as eating all this nice carcinogenic sugarless stuff is concerned, but our awareness is lagging behind. I told her, you are smoking yourself to an early death, that's for sure. If you place an implant on a smoker, the chances of that implant failing is very, very high. This may sound and may be probably quite controversial.
First of all, I would like you to introduce yourself
to
our audience.
Yeah.
Tell them your name, what you do, and probably also who you are, like what this establishment is.
My name is Dr. Johnson Mwangi, and I am a born-again Christian. I love the Lord. And I am a dentist by profession. Yeah, having worked for the last now about 33 years from the time I graduated from dental school.
The World Health Organization did a study.
Yes.
And it found that 9 out of 10 Kenyans experience
periodontitis. Yes.
Yes, the gum disease.
Yeah, gum disease.
And first of all, are you surprised by this statistic?
Not really, because actually periodontitis is the most common disease. The prevalence of periodontal disease is the highest, not just in Kenya, but actually in the whole world. Yes, it's a bacterial infection, and because of its nature, the way it kind of like starts and presents, then that's why people don't really get to take it seriously. And of course, dental awareness has always been low in most parts of the world, especially in the third world countries, because it starts painless. It's the issue of oral hygiene, especially in our part of the world. Now things are changing, but people do not know about the need to brush their teeth, to brush it well, to go to the dentist every 6 months or once every year. And so it starts very slowly as just that plaque, that food that is left around the gums, the bacteria in the mouth attach, they cause a bit of redness, a bit of inflammation on the gums. So you find the gums changing color, starting to bleed. So now that's the early stages of that. It's gingivitis. And it is, by the fact that it is not painful, then people don't take it seriously. And then because many people, they get gingivitis when they are young, so they've always, every time they brush their teeth, they find there is bleeding. So they assume it is normal for you when you're brushing your teeth for the gums to bleed. So then they don't seek any help. But of course, at later stages, we have caught up with the West as far as eating all this nice carcinogenic sugarless stuff is concerned, but our awareness is lagging behind. Then at that point, then we call it periodontitis, in which case now this is more severe. There's a lot of tartar accumulated around the teeth. You find the breath is not very good. You may find a bit of exudate coming from the gums. And eventually you find the teeth are starting to become loose because the bone has been lost. So this you find, and it was assumed that as you grow older, you will need to lose your teeth. That was the norm. Yes, when you reach a particular age, you lose your teeth. It was kind of like accepted like that because of lack of awareness, basically. Yes, it was almost automatic that you need to lose your teeth. But now we are telling people, no, it is not normal for your gums to be bleeding. It is not normal to have an accumulation of tartar around your teeth. It is not normal for your breath to be not good. It's not normal for your teeth to be loose. Yeah, there's a problem. That's periodontitis, and that's why the prevalence is that high, not just in Africa, even out there in some countries. It's still, and of course, the other factor is probably the cost of dental care. Yeah, dental care, the cost is high because of the equipment, machinery, and all that. In many parts of the world, the government is not able to offer that. And also because of the lack of personnel. There has always been a shortage of dental professionals in most parts of the world because of the cost of training a dentist. It's very expensive to train a dentist. So that means you find that most governments are not able to train enough personnel to be able to cater for the whole population. In many places, you find, like in Kenya, the ratio of the dentist to the population is more than one dentist to more than 1,000 people because of the nicotine, that nicotine and the chemicals in the smoke. They end up affecting the health of the gums. Find that there are large chunks of the country which don't have people to take care of them, health workers, dentists to take care of them. And then those people end up suffering from gingivitis, from periodontal disease. So that is true. But it's been getting better. The awareness has gone up now. It's there in the media. People know about now brushing their teeth and that kind of thing. So we are not where we were probably 20, 15 years ago.
Yeah.
Yeah.
Okay.
Yeah.
In addition to that,
Yes.
to gum disease, there are a couple of other common diseases that a Google search, appears
Yes.
to us, which are things like dental caries,
Yes.
oral cancer, orofacial trauma, dental fluorosis, orofacial infection,
Yes.
and then cleft lip and palate.
Yes.
Now, these were the most common, just generally in Kenya when I did a Google search.
Yes.
Do any of these surprise you?
Yeah, of course, people have always known about dental caries, and I think in one of the videos we addressed that. If you check on our videos, you'll find where we talked about cavities and dental caries and how it presents and what's the management, that kind of thing. So I wouldn't repeat now that on dental caries. But there is another emerging, I would call it an emerging disease, and especially in Kenya, which is dental fluorosis. Yes, dental fluorosis.
Maybe you could start by telling them what that is. Or
Yes, how it presents. Yes. Yeah, the dental fluorosis, as the word indicates, it's coming from too much fluoride in the water. That's why you're calling fluorosis. Okay? What happens is that when our teeth are developing, when they are inside the bone, they are developing, and even intrauterine, when the child is developing in the womb of the mother, for them to develop good, strong white teeth, enamel, and bones for the whole body, they need calcium is what they need. So they absorb the calcium from the mother, calcium from the diet, when in the early stages of their growth, and it's incorporated. It makes the teeth hard, it makes them white, it makes the bone strong. But in cases of fluorosis is where you find that we have too much fluoride in the water. Normally, for the body, I told her, you are smoking yourself to an early death. That's for sure. 1 part per million of fluoride in the water. But in some places, especially traditionally, we knew especially about the Rift Valley. That's where you found dental fluorosis. You found people with brown teeth. Where, like in Lake Nakuru, the one study showed that instead of 1 part per million that we need, there was 2,880 parts per million. That is very, very high. So you find that when fluoride is taken into the teeth instead of calcium, the teeth becomes weak. They become discolored. They can become chalky white, where it's a bit mild. They can get some spots, brown spots, where it's a bit moderate. All in severe cases, you find the teeth are very brown. I'm sure everybody has come across people with very brown teeth, or even some people who are watching this video, they may be. So that browning of the teeth, discoloration of the teeth, the discoloration may vary all the way from brown to just a white ledge to patches to chipping. The tooth becomes very brittle, so it breaks easily. And also that means it becomes very prone. Once the surface breaks, then dental caries comes in very quickly, and the cavity moves very, very fast and rapidly to the nerves. So then you find that people with fluorosis, you'll find that they tend to lose their teeth quite early, even in children. You find the incidence of gum disease is higher because the teeth are rough. That means they are able to attract and accumulate a lot of plaque, which means you find then brushing is not as easy for that particular person. Okay, what is the latest emerging trend? It is actually in the cities. Because of lack of the water that is provided by the council or the water companies, there is this new trend of digging boreholes and among the high rise, especially in the upmarket Nairobi, actually Kilimani, Lavington, Kileleshwa. We find that literally now every apartment has a borehole. And this water coming from borehole has got a very high concentration of fluoride. So now what we are finding, initially, fluorosis was kind of like a disease of some people in a particular location in the country, like Nakuru, Naivasha, and that kind of thing. And a little in the lower demographics of the people, socio-demographics of the people. But now, dental fluorosis has actually become the disease of the rich, you would say, of the wealthy, because they are the ones able to drill boreholes. So it's I would say it's like become a pandemic now. We are seeing it, and I think it's actually a pandemic in Nairobi, here in Lavington, Kileleshwa, and Kilimani. Children are being born, and because of lack of awareness of that, by the time the parents realize, the damage has significantly been done, and the window, so below the age of 8, that's when the damage gets done. And some parents start bringing their children to the dentist when they are 6, 8, 10, something like that, in which case, really most of the teeth, whether they are already inside the bone, they've already been affected by fluorosis. So we are educating the parents on this, that children from intrauterine all the way to age 8 should not take any water from the borehole unless that water is specifically treated and defluoridated. They should drink either council water, or then they may have to buy. And it is not only for drinking, but also for cooking. Many parents have always thought, if I give my child water which is not from the borehole to drink, but if I cook and boil, the fluoride will go. No, the fluoride doesn't go with cooking, with boiling. So it has to be removed. There is now a process. It's becoming cheaper now. There are some gadgets which are there. There are some companies, water companies now, which are installing gadgets in your house, in your kitchen, and it's able to defluoridate that water. So then it is safe for drinking. I think one of the companies, there is a company, Davis and Shattrive, isn't it? And I think there is another company run by one of the younger dentists. I think it's called Bristol something. Yeah, they're providing that solution to the people of defluoridating water. Yeah, anywhere between 30 to 50,000 shillings, you're able to get something that will be able to remove the fluoride from the water. But you need to change the filters and whatever every 6 months or so.
You mentioned parents starting bring their children to the dentist from 6, 8
Yes.
years old.
Yes.
So I'm curious.
Yes.
What age would you advise parents to start bringing their children to
the dental office? To the dental office. Well, we want the parents to bring their children as soon as their milk teeth, they have quite a number of milk teeth in the mouth, we should see those children. Basically, for us to be able to advise them on how to clean those teeth, because that's a challenge. Yeah, you want to help that parent. How do you brush the teeth of that child? What kind of toothpaste should you use? If you're using any, how much you're using, what kind of toothbrush, and how do you actually clean that tooth? And some other questions which may be there. And of course, during that visit, when you bring that child when they're that early, you're talking of about probably 2 years or even below, then we could pick, at that point, we could pick the issue of fluorosis in the few teeth which have already started developing. And because not so much damage has been done at that point on the teeth which are inside the bone developing, if we realize, hi, this child has actually a bit of fluorosis, then we are able to engage the parent. What kind of water do you use? And then empower the parent. That way, we are able to forestall this child getting full-blown fluorosis. And it has happened. So I think the earliest parents can bring from about 1.5 years, it would be good to just do a visit to the dental. From age 3, of course, we insist the child needs already to be in the dental office because they have all the full complement of the milk teeth in the mouth. They should come to see the dentist. And we like them to come before they go to school, because then we are able to kind of they get socialized in the dental office rather than allowing other children and their teachers in school who don't have any dental awareness to be the ones to socialize them on dentistry. It is better us, we can format the hard disk of the child the way it should be as far as dentistry is concerned. But by the time they go to school, they are given very funny stories by other children and their teachers. Coming back to reformat that hard drive is usually very hard.
We actually spoke of that in a video, the fear
yes,
of the dentist.
Exactly.
Right? And we say that a lot of it is brought about when someone goes to school for the first time. Their friends are telling them, oh, this was my experience.
Yes.
And they're probably exaggerating it.
It will always be exaggerated.
Exactly.
Yes. So we like if we can do it early enough before the child goes to school, then they already go and tell a good story to the other children, or how they like their dentist, how when they go there, they're given a balloon, or how they go there, there are swings there, or something like that. Some of them, they like our hot chocolate. So those are the stories we want them to go and give to school. Yes.
And in a way, they are
become ambassadors.
That impact.
Yes.
They are now kind of going that opposite way of the typical, oh, my experience was bad.
Yes.
My experience was good at the dentist.
Exactly.
Visit the dentist.
Yes. Now we have very many children who come to tender care who want to come. So, and it goes even up to, they think they have an issue.
Experience.
Yeah, this tooth, I have a tooth that is hurting. I want to go to tender care. Then they come, we just check, nothing. Then we laugh. This child wanted to come here. They have good memories. They got a balloon last time. They got to swing. They got to take chocolate. And there you go.
The no technology center.
Exactly. Yeah. Those are the kind of patients you want to have. Yeah. They're telling the mother, this tooth is shaking too much. And then they come here, we find it's not tooth that is shaking. They just wanted to come.
Yeah.
Wow.
The experience. The same thing we talked about earlier. It's that experience that you're giving them on a day-to-day basis consistently.
Exactly.
Right?
Yes.
So I would like us to move now to talk about what common problems are treated at tender care dental. I know we probably have a wide range of services.
Yes.
But if we were to look at it and zero in in a period of 6 months, what do you see repeatedly in terms of conditions and procedures do you see you perform more frequently?